So thank you, Isaac, and thank you to Dr. Magdi as well for the invitation and the opportunity to speak today. Given the time constraints, I've only got 10 minutes, so everything here is going to be very high level, so I apologize in advance for that. If there are any questions, obviously we have the Q&A and our contact details for our company are on these slides, so please don't hesitate to get in touch if there are further questions off the back of this. So the first thing I'd like to address is a really basic question. Why should we be testing for COVID-19? And it may seem like a really obvious question, and probably each territory has a slightly different rationale for doing so. But certainly from the very start of the crisis, the WHO has recommended that testing is a core component of the fight against the virus. And I think there are probably three major rationale for that. The first one is probably obvious, is keeping track and understanding the exposure to the virus. And His Excellency Dr. Kasim highlighted in his opening remarks that the number of cases currently being reported is nowhere near the true number. And it's very difficult to obviously coordinate any efforts to combat the disease without knowing the extent of the issue, where the virus exists and where it's spreading most rapidly. And then off the back of that, obviously, of the point of view where when you're identifying these cases, it enables people to isolate. It enables, therefore, people who know those people, health professionals, other members of the public, to go about their business in a kind of confident and unusual manner. And then thirdly, and I think really, really importantly, as more and more countries are rolling out the vaccine to more and more of their population, testing for the virus allows a country to understand the impact of the virus, and if it's working as it should be working, as we expect it to work. And perhaps more importantly for Yemen, the testing is almost an interim solution before you have that whole virus rollout in place. You know, Dr. Adham spoke in the QA as well about diagnostics being really, really key before we have this vaccine rollout. And whether that be for logistical reasons or whether there's a low vaccine take-up, testing for the virus and allowing healthcare workers in particular to have regular testing is really, really, really important before you have this vaccine rollout. I'd like to also quickly discuss the different types of COVID-19 tests. Now, there are really, really many types of tests available on the market. But I've highlighted three of the most commonly used ones here. If we focus first on the top two, so the PCR and the rapid antigen, these two types of tests are both designed to detect patients who currently have the virus. So PCR obviously is probably known as the gold standard of testing and has been since for the last year or so. Is really seeking to detect the underlying genetic material in the virus. And if it's done correctly, it's really very, very, very accurate. The disadvantages of PCR is really the complexity of the process. It requires a laboratory, obviously, a number of quite complex machines. Dr. Adham, of course, highlighted in his remarks that there were issues with missing components across the country. So that really is one of the major drawbacks of PCR, is the complexity. And off the back of that, the cost of administering and buying the equipment. Another disadvantage might be the length of time it takes to process that. And if we contrast that then with the rapid antigen, which I'm sure many of you on the call have probably seen, it comes in quite small pouches, little plastic cassettes. And in many cases, it's kind of so easy to use that the user can administer the test themselves. It's easier to store and it's easier to transport when you compare that to PCR. The results are available in 15 minutes. So it's really a lot more practical than PCR. One potential disadvantage, I would say, of the rapid antigen is the fact that it doesn't sometimes pick up the really weaker cases, or those cases which are potentially older cases and maybe not infectious anymore. So from that point of view, the fact that it doesn't detect those weaker cases can be construed as an advantage as well as a disadvantage, because in certain situations, you might not want to isolate or highlight such a case which is already not infectious anyway. Talk very briefly just about the kind of types of testing which are generally being used worldwide. So PCR, like I said, was the gold standard and the original method for testing. As the technology for the lateral flow antigen tests, as well as I guess the industrial capacity for these things, more and more countries, especially in Europe, South Asia, Latin America, are moving to a kind of, I mean, they're spending millions, and not just spending millions, but investing millions, and also really relying, I guess, on antigen to do the day-to-day testing of kind of healthcare workers, other kind of workers, members of the public, and using PCR as almost like a backup, or where a confirmatory test is required. And we expect this trend to probably continue. So about how we go about testing and the strategies which different countries are using. Now I understand, I'm not an expert on Yemen, but I understand that PCR is used almost exclusively just now. I would suggest that rapid antigen offers a solution for some of the problems which I'd highlighted earlier, and certainly the countries which I've listed here. I've gone down that route as well. There's probably as many different strategies for rapid antigen testing, or testing in general, as there are countries in the world. At one end of the spectrum, you would have a strategy where you're testing as many people as you can, as often as you can. You know, and I think at one point Boris Johnson's moonshot testing program was aiming exactly for this. Now that, as it turned out, that didn't actually turn out like that. But for example, if you look at the screens, Slovakia a couple of months ago implemented a system where they were testing every member of their population, or at least a large proportion of their population, every week, at kind of special stations in various cities and towns around the country. Now that's obviously a severe case, but I think they saw reduction in cases of perhaps around 58%, I think it is, after 2 rounds of this kind of testing. And obviously you can't say that that's directly attributable. There are other factors at play here, like lockdowns and other interventions, but it's still quite an impressive statistic nonetheless. In the UK, I would say our focus just now is broadly on healthcare workers, and ensuring that every worker in the NHS has access to regular antigen testing, and I believe twice a week for active NHS members is the current rollout. The government have provided those tests, and I think send out to each worker's home, and they're expected to administer the tests and report the results if required by themselves. For non-healthcare situations, so other employers, the government again does provide antigen tests. It's not a legal requirement for those employers to test their staff, but it is very much encouraged. In other countries, so for example in Czech Republic and Germany, the situation is quite similar to the UK. The major difference is how it's funded. So in European countries, it's predominantly done through the private sector, and then often reimbursed by the government if the test that they bought is on an approved list. Probably running out of time a little bit, I'm not sure. So I'll skip straight to the consistent features and what might be good for Yemen. I would thoroughly recommend a focus on protection and testing of healthcare professionals. We see this in pretty much every country around the world. You know, there's so many differences in the strategies implemented, but that's quite a consistent feature. Clearly, these individuals are key to the fight against the virus, and even more so in Yemen, where there's not a huge number of healthcare professionals. They're working in areas of potentially high prevalence of the virus. So it's really very beneficial to test these people on a regular basis. And then the other area which we obviously see a lot of testing still is at border areas. And this is one area where a lot of countries still rely on PCR in advance, and they rely on travelers to take that test in advance of traveling. But more and more we also see we also see countries require rapid antigen testing actually at the border. It takes place there. The final slide, just a quick introduction to Edinburgh Genetics. We offer all the kinds of testing which we've talked about in the presentation today, and others obviously as well. The product is fast. It's kind of has results in 15 minutes usually, and is used across European countries just now, as well as other countries worldwide. I remember we provided rapid antibody tests, I believe, to Yemen. I think it was in May or June last year, and obviously we would be more than willing to provide antigen tests if the Ministry of Health or the WHO are willing and interested to explore such an option. I know it says on the screen there that samples are available free of charge to the WHO and Ministry of Health. Really, anyone who's interested in sampling these products and understanding them more, we're more than happy to help out with free samples on that. And then finally, probably maybe not so much related to COVID, but in the future and potentially at the same time as well, the kind of the technology behind rapid antigen is also very effective for other diseases as well. So you have the same kind of product available for other viruses such as cholera, malaria, influenza, etc. And obviously, if there's expertise in the UK, which our company Edinburgh Genetics is not privy to, then we're also more than happy to act as a linkage between the ministry or whoever needs it in Yemen to other companies in the UK to share that expertise as well.